Okay, I'm speaking with Meleesa Johnson, who was, you were the chair of the
Healthcare Center Committee.
Healthcare Center Committee, correct, and you are now not running for re-election to Portage County Board, so your comments are just informed by the work you've been doing for the last 4 years. Can you briefly explain the issues behind why the referendum is needed and sort of especially the cost aspects, because I know there's been a lot of information and incorrect information going around.
Yeah, well, I think you need to step back because probably 3 or 4 years ago, we actually evaluated what it would cost to modernize this older facility. And at that time, it was $12 to $15 million. Mm-hmm. Bring in air conditioning, upgrade the electrical, replace all of the windows do asbestos abatement, bring in a new boiler, a completely new HVAC system, a new roof. All of that needs to be replaced. And at that time, $15 million. And so we kind of backpedaled and said, well, what would it cost to build a new? How many rooms do we need? What kind of services do we want to provide? And we couldn't answer those without doing the research. So that's why we hired an accounting firm that specializes in healthcare to help us understand the market. What's the demand? What does it look like? Will we even need skilled nursing? And then we hired architects to actually spec out a building so we can get an idea what it would cost based upon the evaluation from the accounting firm. And that came together and told us that we can build a new facility with potential for 42 rooms, 57,000 square feet for just shy of $20 million. So your choice is, do we put lipstick on the pig at 15, or do we build a new facility that's going to be state of the art and will last for another 40 or 50 years for $20 million?
Actually, I'm rather surprised at that. The difference being not as great as you would think.
It's very expensive to remodel. And I'm finding that out now for my profession as part of, because we bring in a lot of demo projects into the landfill.
Right.
And people go, why do we have to destroy all those buildings?
Yeah.
It costs more to rehab a building than to build something new.
That's amazing.
Yeah, and that's just the sad truth about it. So it made more sense to look at the new building. It actually has a more compact footprint. It still will provide plenty of the kind of care we have now, both long-term care, rehab. It'll provide additional services, outpatient rehab, a lot of those things that will help bring in a revenue stream. And we have to ask the taxpayers. Otherwise, we'd be trying to steal it from Parks Department or the library or wherever else.
Right.
And I don't think that's fair, so we said as a committee, and then County Board agreed, that it was important for us to take our plan, what the accountants had told us on the market study, what the engineers or the architects have said, blend it together, come up with that price point. And if you look at the modeling on the business model, we're asking for up to $4.5 million. If you look at the first, I think it's 5 years of that business model, we don't even get close to that. Because of, again, when you've got a more efficient building, you need less staffing.
Yeah.
And we'll have, it'll be energy efficient, so the cost of running it will be less. And then we will have a community-based residential living facility, so kind of like an assisted living. The Medicare reimbursement for that is higher. So it helps to supplement as a revenue source for the whole building.
That's great. Now, in all of the discussion leading up to this, County Board has discussed two possible ways of paying for it, or let's should say, two streams of paying for it. One would be to use our considerably good credit rating to take out bonds to do the work,
Right.
and then to pay those down, perhaps over a longer period with the levy. So how is that? How would that work if we did that?
So this would be revenue bonds because this is technically an enterprise fund.
Right.
So it's a business within county government. So there's two kinds of bonds. There's your regular municipal bonds, and anybody who buys municipal bonds get those as tax. They can deduct them on their taxes.
Right. Yeah.
A revenue bond is not deductible, so it's a different form of bonding. We can still enjoy the county's superb credit rating.
Right.
In issuing those bonds, it's a little bit different than issuing municipal bonds.
Yeah. And what would be the payoff time on that
20 years.
on a revenue?
Yeah.
Okay.
So 20 years. So when you look at the business model, you'll see all kinds of expenses, staff and equipment, and then you get into the debt service. So the debt service is rolled into the operational expenses.
Okay. Yeah, that makes a great deal of sense.
Yeah.
Okay. So really, if people vote yes on the referendum, they're not voting for a gigantic property tax levy increase on their house, right?
No, the average house, according to Zillow right now, is about $200,000 in Portage County.
Right.
And I think I did the cost evaluation, and I think it's about It's about $140 a year for that price of property. That's the increase. So, your property, my property, will be pooling those resources to invest in the future.
Yeah.
So, and here's the other thing. A lot of people, this is where old people go to die. No, it's not.
Right.
It's for people to get back to normal life. We have rehab patients in here who are as young as 30 years old. Suffer an accident, they need longer term care. Once they're made whole, they return to their homes, their neighborhoods.
Yeah, the term is skilled nursing facility.
It is skilled nursing facility.
Yeah,
yes.
yeah, and it's not
It's not an old folks home.
Yeah, and it's not a hospice center.
No, and there are hospice services when those are needed.
Right, exactly.
But for the most part, our patients don't stay with us very long.
Yeah.
They become healed, they become whole, they return to their homes. Our elders live independently. Those younger people can now return to jobs. That's what we're invested in.
Right. Okay. Is there anything else that people should take in their mind into the voting booth?
Again, I think
Tuesday.
the most important thing, don't think old folks.
Yeah.
Don't think old folks home. This is a facility that helps people get back to regular life.
Yeah, that's a good way to frame it.
Yep.
Well, thank you very much, Meleesa Johnson, for your time in this.
Sure.
And
Thank you, Bob.
if I forgot to ask anything, okay.
You got it all covered.
Thanks so much.
You're welcome.
Very much.